What role does humidification play in COPD NIV treatment? Imagine breathing in a way that feels more natural and comfortable, even when using a machine to help you breathe. That's where humidification comes into play during non-invasive ventilation. Non-invasive ventilation is a treatment that uses a mask to deliver pressurized air to help keep your airways open and improve breathing. It's often used for people with chronic obstructive pulmonary disease, especially during flare-ups or when breathing gets really difficult. But the air delivered by the machine can be cooler and drier than what you normally breathe. This dryness can cause discomfort, like a dry mouth, sore throat, or nasal congestion. For people with COPD, whose airways are already irritated, this dryness can make symptoms worse. It can cause mucus in the airways to become thicker and stickier, making it harder to clear out. That can lead to blockages or even infections like pneumonia. Humidification adds moisture and sometimes heat to the air coming from the ventilator. This helps keep the lining of your nose, mouth, and throat moist. When these areas stay moist, the tiny hairs called cilia can do their job better. Cilia help move mucus and trapped particles out of your lungs. When the air is moist, mucus stays thinner and easier to cough out. This reduces the risk of infections and makes breathing feel more comfortable. Humidification can also make it easier for you to tolerate the mask and the therapy overall. If the air feels dry and uncomfortable, you might be less likely to keep using the ventilator. Adding moisture can help prevent side effects like dry mouth or sore throat, making the treatment more tolerable. Some studies suggest that when humidification is used, bronchodilator medications work a bit better. These medications help open the airways and are often used in COPD. When delivered through the ventilator circuit, humidification can help these medicines reach the lungs more effectively. The need for humidification depends on how long you use NIV and your specific symptoms. For short-term use in the hospital, it might not be as necessary. But if you're using NIV at home for a long time or have very dry or sensitive airways, humidification becomes more important. Factors like the climate or the settings on your ventilator also influence whether humidification is needed. Usually, if you are using high-flow settings or have a history of nasal dryness, your healthcare provider will recommend humidification. In the end, adding moisture to the air during NIV helps keep your airways moist, supports mucus clearance, and makes the therapy more comfortable. It's a simple step that can make a big difference in how well you tolerate the treatment and how effectively your lungs can clear mucus. The decision to use humidification should be based on your symptoms, your comfort, and your healthcare provider's advice.